would say I never really started out to become an entrepreneur. In a way, the purpose found me. And part of that was because, as I mentioned in my previous role, which I really enjoyed, I realized I was making a difference at a much bigger scale. However, I was still consulting to corporations and working more with corporations or enterprises as opposed to consumers in some sense. So I was still a little bit removed from how my work and my thinking and my contributions are really moving the needle from an everyday perspective. My parents live in India. A few years ago, we started noticing some functional decline with my mom, and she started having more frequent falls. We couldn't really figure out what was the problem, but the shift prompted me to start looking into what is happening, how do we help her, and how do we really, especially remotely, help her navigate all of this, because it's me and my brother, just two of us, and both of us live in the US. Our parents were aging by themselves in India. It turns out finally it's Parkinson's. But what stood out for me in all of this is this long journey to discovering a diagnosis. In some sense, the diagnosis came as a relief, if I may use the word in this context, because at least now we know what it is that we're dealing with. Before, it could have been any number of issues, and just that experience alone prompted me to look into how do neurological conditions really affect our day-to-day living, particularly as a family, as someone who may be experiencing it, and family members who are seeing how a loved one is experiencing that, and that discovery path. And then the more I started looking into how are others navigating this, what is this discovery like for others, it just was this consistent discovery of everyone really figuring their way through this maze of discovery around whatever diagnosis it is, particularly the case with neurological conditions. And having been a consultant in the pharma space, I also knew that there weren't that many therapeutics that were in the pipeline that could really cure many of these conditions. Maybe temporary support and maybe slowing down, but no real cure. So that's what led me to the realization that this is just the beginning of the journey, just getting to the diagnosis. And then there is a long road ahead of how do you actually manage this and slow this down, or help your family members slow this down to the extent possible and get the timely help that you might need, either from the healthcare system or any community support that you can find to really manage this. And for me, that was the realization that made me start looking into what are potential solutions in the market. How is everyone doing it? And this is me with my years and years of corporate strategy and a strategic mindset kicking in and saying, how can we not plan for this? So as a company, our mission is to really empower families. And when we say families, it encompasses the caregivers and the patients to confidently manage complex care around neurodegenerative conditions. We particularly focus on neurological disorders, especially those that are cognitive in nature, primarily because we notice that is where the older adult or the patient is slowly losing their agency, and hence relying very much on family or some other type of external provider to help them navigate all of that. And this is something that is extremely challenging for most families because there are complicated family dynamics at play. Everyone in the family has their own set of perspectives around it. And often they're in a reactive mode when it comes to discussing their options and figuring out how to navigate all of this. So what we have developed is a platform called Care Wallet. It is currently a web-based software, and it's HIPAA compliant. And the idea with this platform is we can provide virtual care planning and care counseling, meaning when we onboard somebody, we actually do a full assessment across the board to understand what is the unique nature of this patient or the person's needs in a home setting, and really create a care plan that works for them, in addition to what we're seeing from the clinical side, which is mostly their health and the medications and the treatment protocols that they need to follow. We also think about how do we help them with their functional needs at home? How do we think about their cognitive needs? Especially in the case of dementia, we look at behavioral changes that are happening with the person, and layering on this additional detail around finances. And what we mean by that is often there is a very heavy reliance on support systems and resources in the healthcare system. So because when it comes to long-term care, navigating Medicare and Medicaid and finding supports that you're eligible for is complex in itself. And often families are not even aware of what's out there for them to support them in this journey.